60 cases yesterday, 19 unlinked. Health Minister Andrew Little's with us. Morning to you.
Good morning, Mike.
Got some numbers from overnight for us?
No, we get a sort of an interim update late in the afternoon yesterday. They're looking better, but look, I don't want to give numbers now because we just don't know what it's going to look like in terms of the overnight count.
Okay, so better's good. Having said that, did you make some progress on the unlinked cases yesterday?
Haven't had any update on that. There's quite a bit of work gets done overnight on that, so I suspect by later today we'll have those numbers will look better in terms of unlinked cases from yesterday.
What about the woman causing all the trouble?
Yeah, well, that is a major problem. She's not disclosing a great deal, but we've got our usual contact traces from health involved, plus we've got the police involved as well. It's clear that her way of getting across the border north was to use documents where she didn't quite tell the truth. And we just don't know precisely from her where she says she's been. The police have picked up a lot on CCTV footage, so that gives us a better idea, but we just don't know with any accuracy where she's been. Anyone
in the government thinking that your links to the gangs is not particularly helpful for the rest of the country?
Yeah, I don't want that question to suggest that there's any gang link with this woman concerned, because that simply is not correct. That's the advice from the police as of yesterday. But we know that in terms of earlier in the outbreak, there were gang members infected and therefore their family members affected. The reality is that they've got to be vaccinated, tested, just like everybody else, and we've got to find ways of getting into that community because they're not that the easiest ones to deal with.
Have you already made today's decision?
No, still awaiting advice. We sort of tend to get final advice 2 or 3 hours before the cabinet meeting with the update from overnight, and we just haven't had that yet.
How cognizant, hand on heart, are you of the pain that's being caused in increasingly large geographic areas of this country through businesses who probably will not make it, and if they do make it, they're hanging on by the skin of their teeth, as opposed to the balance on the health side of the equation? Are you aware of just how many people are suffering?
Yes, hugely, and that is a centrepiece of the discussion we have every time. It goes into the formal cabinet paper that gets tabled. There's a long assessment of the economic impact on people. The other one is, of course, psychosocial and mental health impact as well. And we know that's having a real effect on people, young people in particular, and families. So we look through all that and we weigh that up against the health risk, which is why starting last week, and regardless of what people might characterise the presentation as, we've got to start trying to reduce those restrictions because it is tough on people, but we've also got to look to protecting people's health.
Yes, we do. Is 60 something to freak out about?
Look, it's not good this far on in the outbreak. It tells you that it's not contained, and this is where we're trying to get to. If we knew that all the cases were linked one day to the next, that'd be far less worrying. It is worrying when you get that number of unlinked cases.
Yes, it is. But we've had this same scenario we're just completing week 8, but we've had the same scenario in week 7, week 6, week 5, week 4.
And that's why we've got the real push on vaccination. There is one critical way through this, and that is maximum vaccination for everybody. That's why we've got the big day this Saturday, the big Vax Day, Super Saturday. We've got to get that vaccination numbers up. It's looking encouraging. It looks like we can easily get to 85%. We want to make that push to get to 90%. This will make all the difference.
But difference to what? What's the target? New South Wales today, they're opening because of 70%, then they're going to open some more because of 80%. They've got a target. We don't have a target.
We're working to 90%.
Is that a target?
I have to tell you, it's become the target. I mean, we would like to go. Our worry is that you set a target and you get there and people think, relax, right, that's it. None of us else have to get vaccinated. The reality is what vaccination does is, even for those who are kind of really worried about it, is it means that if you do get infected, you'll be way less sick than you otherwise would be.
Of course. Yeah. I think apart from idiots, we all understand that now. Yep. Having said that, can we say that 90% is the target, and therefore if 90% is the target, what happens when we get to 90%?
Then we can start seriously reducing those restrictions, not just the internal ones, but on the border and so on.
Like what? Shops open? When do shops open? When can I get my hair cut?
Well, this is where we're trying to get to, even in this sort of modified level 3. But we get those vaccination rates up, we can drop all that stuff, and then start to really relax the borders as well. I mean, we will manage people coming from specific countries because we know there is high risk, but we can start looking at all those things. We can, and even those coming from high risk countries, we can change the way we isolate people when they cross the border. So All of those things come into play.
A couple of related things. Have you read Kate McNamara's piece in the Herald over the weekend about Hendy and the money you're giving him?
No, I haven't seen
Right,
it.
$6 million goes to one, well, not one man, but one group alone, and it's not contestable. Why?
I can't tell you that. I'm not quite sure what the arrangement is.
You're the health minister.
We have a COVID-19 response minister who's been responsible for all the paraphernalia around our COVID-19 response.
If you were spending as health minister $6 million, would you expect it to be contestable?
Well, there are rules for government procurement, so I don't have an answer for you.
Well, the rules are that it must be contestable. For it not to be contestable, it's breaking the rules, your own rules, isn't it?
I don't know the detail behind this arrangement, so I just can't comment on that.
Did Pfizer ask for a couple of $100 million like they asked for the Australians up front before the jabs arrived?
No.
So they asked for nothing up front?
No. The way advanced purchase agreements work, and we do these, and we've just done one for these therapeutics, is that often you pay a down payment when you sign up your advanced purchase agreement, and then you pay on delivery. So
did they ask for an upfront payment or an advance payment?
I'm not aware of any request for an advance payment. I don't recall any approval of any advance payment of that sort of size for Pfizer or for any of the drug companies that we've signed advance purchase agreements for.
For Chris Bishop's letter last week, wasn't his letter specifically, but the letter that was from Pfizer to Crabtree, and it took 6 weeks for you guys to even have a meeting. Why so slow?
Again, I can't respond to that. I just don't know what the circumstances were.
Does it seem slow?
Well, we're dealing with a nationwide pandemic. There's a lot of urgent activity going on. I'm surprised to hear that, but I just don't know the circumstances.
Appreciate your time as always, Andrew Little, the Health Minister.